Welcome everybody to day 3 of Zoom University. My name is Shariese Martin, the education lead of TTM. Today we will be talking about physical health education, um, mainly focused on women's health, but we will have a little information for men. And if more information is needed, we're always a good resource, and we can get you the information that you need. Um, so Miranda says, hello, everybody. Thanks for joining us because she knows I'm going to call her out and ask if she wants to say anything, and she just wants to get ahead of it. So I'm not going to ask her to say anything. Miranda is our president and founder. So I just want to throw that out there. So tonight, our speaker will be Jackie Chestnut. Yes.
Yes. Hi,
Awesome.
everybody.
Jackie works at Women's Healthcare Center of Houston with me, although I don't know if we've ever seen each other in the office um, because I'm hardly ever in the office. But she is going to be our speaker for the night, and I'll let her introduce herself a little bit more and go ahead with her segment.
Okay, so hi, everybody. So, yes, my name is Jackie Chestnut. I am a women's health nurse practitioner. I've been a nurse practitioner at Women's Healthcare for a little bit now. And before that, I was a registered nurse in labor and delivery. So, I have a lot of experience with women's health, and I do have some information for males today, but not much, but I will be able to answer some questions if you guys have any. So I was asked to talk to you guys about physical health. So initially I was wondering what I could talk to you guys about, and I was told my audience is between 11 to 18. So I do know those adolescent teenage years, puberty is a big issue. Understanding your menstrual cycle is a big issue. And then I went to social media because, we get a lot of information out there nowadays. So on social media, I asked the question, what are some things you wish you would have been explained better to you when you were going through puberty? So I got a lot of answers. So I'm going to read some of those answers now. And if any of those things resonate with you, you can chime in and we'll talk about some of those things, plus some of the other information that I do have prepared. So some people said they wish they would have had more clarity on the changes that would occur in their bodies. And they wish they would have been assured that the changes are normal. Somebody else said they wish somebody would have explained to them that you don't need to have multiple boyfriends or girlfriends to be accepted. I know being accepted is a really big thing during adolescent and teenage years. Somebody else said they wish somebody would have clarified to them why you should wait to have sex. That people are always saying wait, 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 but nobody really tells you why. Or that now that she's older, she now understands there's an emotional side to waiting to have sex. And also that even if you think you're being careful with sex, you can still get certain sexually transmitted diseases even while using condoms. Somebody else said that they wish they would have understood that puberty is just a temporary season, but the decisions you make based off how you're feeling in puberty can affect your adult life. Other people wish they would have knew more about how important nutrition was at that age. A lot of people didn't understand hormones. Somebody wanted to know what to expect and how to prepare for their period. And then, let's see, I had a whole lot of people who were asking about emotions and hormones. So it seemed to me like most people wish they would have had more clarity on dealing with the hormone changes. A lot of people wanted to feel accepted and wish they would have knew better ways. And some people just wanted to know that what they were going through was normal. So as teenagers, we always feel like, we're different. We want to be accepted. Sometimes there's a lot of insecurity, but a lot of the changes that happen are normal. And it's not just us or teenagers that are dealing with that. So if anybody resonated with any of those topics and they want me to talk about anything first, you can let me know.
Yeah. So for me, I think, and I'm not a teenager anymore, but speaking from I don't know what I am at this point. I'm a young adult, I guess still. But I'll be 32 next week, and there are a lot of changes that I'm going through now that I thought I was past that point. I didn't think I was still be encountering these changes. Some physical and some emotional. And so a lot of the things that I'm going through, my sisters have been going through it or went through it a long time ago. And here I am, 32, just now encountering it. And like I said, I thought, I had beat that. And now here I am, 32, and I'm encountering it. So I wish that would have been explained to me that it doesn't matter what age you are, you're still susceptible to going through some of those things that we've deemed for the younger 20s and
Yeah.
teenage years.
Yeah, even now, in working in the nurse practitioner role, I had like today I had a patient, she was 51. She's still going through hormone changes. The hormones are constantly fluctuating all the way through life. So you're constantly having to deal with new emotions, deal with new hormone fluctuations. It's just a natural part of life. So it's not only teenagers. Teenagers shouldn't feel like something is wrong with them. It's just as you get older and you understand the hormones, and hopefully you have a good doctor who will help you process the hormones and what you're going through, then you can better handle them depending on the stage you are in life. So I know a big thing in the adolescent or teenage years has to do with puberty. So I was going to talk about puberty, the female reproductive system. I do have a little bit on the male reproductive system. We were going to talk about the menstrual period a little bit. And then just normal, like with puberty comes vaginal discharge. We're going to talk about what's normal, what's not normal. With the menstrual cycle, things that could be normal or abnormal with that.
Okay,
Um,
Jackie, that
yeah.
those you can go ahead. Don't feel like there's anything that you can't speak on just because there's not a lot of younger people on the call because this is being recorded and they'll have access to this.
Mhm.
Um, but also there's people are putting things in the chat. I don't. You should be able to see it as well. Um, but I'll go ahead and read one comment that Tiffany left. She said, "My 17-year-old son wants to know when he will stop growing height and feet and changes with his voice cracking, then coming back deeper."
So males tend to go through puberty a little bit later. I want to say around, I mean, he should be getting towards the end, around 18, 19 is when males normally stop. That's when the big growth spurt stops. So he might, yeah, I think he'll probably still be growing until about 19. His voice cracking should start to slow down. Like it should be where it's supposed to be now or within what I'm assuming, is he almost 18? Around 18, he should be where he needs to be for his voice. The growth might still be going on for another 2 years. I would say it's about 19. The boys, they start, so therefore end a little bit later.
Okay, I'll let you know if she follows up with anything else, but you can go ahead and go with your the rest of your presentation.
Okay. So do I have any younger girls or on here who have any specific questions maybe on cycles or puberty? Or should I just summarize, I guess?
I guess you can just go ahead and summarize because right now, I mean, it looks like all of us are considered older. But it's still good. I mean, we don't know what information people need, and that's why I wanted to. That's the thing. Like sometimes as adults, we know that we should have certain information, but we don't necessarily have it, and we're kind of afraid to ask those questions. And so, getting that information out there to everybody, I think it'll be helpful.
Okay. So yeah, I'll just go off of my notes, which It was intended for a younger audience, but hopefully you'll be able to help everybody. And then if we have any questions at the end, hopefully I'll be able to answer them. So I was really just going to talk about puberty and explain the changes and just kind of let young girls know that puberty is a natural process. It's basically where the body is starting to change and mature, and it can start as early as 8 for girls. Average age, though, is around 12. And like I said, males are a little bit later. So average age for males would be around 14. So during puberty, we have a lot of hormonal changes. We have estrogen and testosterone. Males and females both have estrogen and testosterone. And so we have those fluctuations that change during puberty. We also have a lot of physical changes. With puberty comes weight gain. For females, it tends to be around their hips. That's when they start to get a little bit curvier. But males can gain weight also. We have pubic hair growth. Your breasts start to develop, and it is normal for your breasts to develop at different rates. Even as grown women, if we actually paid attention, you notice that one breast might be bigger than the other. So that's normal. I know a lot of girls are self-conscious about that, but it is a normal thing. During puberty, we also start to get armpit hair, acne, and body odor, especially, well, both girls and boys in the teenage years. Boys tend to be a little bit more stronger than girls because they tend to be more active. So there's also an increase in vaginal discharge. Girls start to notice that. A lot of girls are concerned or really just unsure of what it is. The vaginal discharge is normal. And with puberty, we focus a lot on the reproductive system. So for the female reproductive system or anatomy, we'll go into a little bit more detail there. So when people think of the female reproductive system, they tend to just say vagina. But actually, the vulva is what's on the outside. So when you look at the female anatomy, you're actually looking at the vulva. The vulva covers the vagina, and the vulva includes the clitoris and the labia. So inside of the vulva, then you have the vagina, which is the opening, and in the vaginal opening, you have the uterus and the cervix. So speaking of openings, a common question that when I was working in labor and delivery, I'll have some 20-year-olds, some even 30-year-olds who aren't sure exactly how many holes we have as women. As a labor and delivery nurse, I would put in a Foley catheter into a woman who had an epidural. And so a lot of questions I would get asked is, are you going to take the catheter out when it's time to push? Or how will the baby come out if there's a catheter? So we have more than one hole. We have the urethra, which is a tiny hole in the vagina, and that's where pee actually comes from. That's where you urinate from. That is where the Foley would go if somebody needs to drain your bladder. So there's that hole. So if I put the Foley catheter in, it's not blocking the vaginal opening, which is, I guess, the main hole that people would think of. So in the vaginal opening, you have the uterus and the cervix. That hole is where we bleed from during our cycles. And that is also where babies come from when you're delivering as young women. Then we have a third hole, which everybody has, male and female, which would be the anus. So as far as women, we have 3 holes, and then the males have 2. Let me see. So the vagina is a muscle, and the vagina is a muscle that contracts and expands. So that means that in the vaginal opening, you can put in a tampon. So something as small as a tampon, the muscle can contract enough to hold it, but still that same vaginal hole can open enough to push out a baby. So it's a big muscle that can contract really small and then expand really big when it needs to. I think I see questions coming up.
Yes, ma'am. We have 2. I'm going to ask Carrie's question first, just because it's more on topic, and then we're going to go back to Tiffany's question. So Carrie's question is, while we're on vaginas, can we touch on hygiene, pH, BV?
Yes. So I have some information tied to the vaginal discharge. So vaginal discharge is normal. It starts to increase during puberty because of all the hormones. A lot of young girls are confused. You might start to see vaginal discharge when you wipe or in your underwear. Some people have to wear panty liners. The amount of discharge depends on the female, and just because you have a lot doesn't mean that there's something wrong. So normal vaginal discharge, the color should be clear, white, or off-white. There should not really be an odor. Now, everybody has their own distinct odor, but it shouldn't be like a strong or fishy odor. So that's normal. Signs of a problem or infection would be if the discharge is like a greenish color. Sometimes it could be a very light yellow color. That could be sign of infection, or a grayish color. Or if it looks, we call it frothy, or maybe foamy, little bubbles, maybe like, I don't know, milk or spoiled milk maybe, or if it looks chunky like cottage cheese. Those could be signs of infection, could be signs of yeast or bacterial vaginosis. If you ever notice a really strong fishy odor, that could be bacterial vaginosis, which is just an accumulation of bacteria, not necessarily a bad thing. Is you can easily go to the doctor's office and we would give you a medication you would take for maybe 7 days. So sometimes if you have bleeding and it's not during your cycle, that could be another sign of infection. That might be more of an STI. The main thing to worry about, though, when you're talking about vaginal hygiene and preventing these infections is really to be clean. Of course, we want to take showers daily. Even if you get sweaty and you're not able to take a shower, like some people might go to the gym, or young kids who are in high school and they get really sweaty at practice and not able to take a shower right away, freshen up and maybe change your underwear. Wear cotton underwear more than thongs. A lot of, I don't know if teenagers are wearing thongs or maybe older, like 20s or whatever, but not every day. And then don't sleep in them. Let's see. Starting from the age of 21 is when we start doing pap smears now. When I was younger, we started, I think, at 18, but they don't start till 21 now. During the pap smear, we can check for not just HPV or not just cervical cancer, but we can also check and it'll come back and tell us if there's yeast or any kind of STDs related to that also. Another important thing that some people might not know is when you're wiping, you always want to make sure you wipe from front to back, because if you wipe from back to front, the bacteria that comes from your behind will then transfer to your vagina, and that'll cause a lot of irritation and infection and inflammation. So it sounds simple, but some people just didn't know that. Or sometimes in the office when we're doing a urine culture, bacteria will show up, which a little bit of bacteria is normal, but bacteria tends to show up because people just didn't wipe correctly. Make sure you're not using harsh soap when you're cleaning your vagina. When you're cleaning the vagina, you really want to clean the outside, nothing too strong on the inside. Well, really, I would say no douching. I don't know if people still douche. It was big back when I was growing up, and we don't recommend that anymore. That'll just throw off the pH balance. I hope I answered the question.
Absolutely. Can we speak a little bit more on pH and what that actually means?
Um, so I guess like I don't have specifics, but pH balance, we want our whole body to be pH balanced, including our vagina. Certain things will throw off the pH balance. Sex can throw off the pH balance. Your period will throw off the pH balance. But the thing about the vagina, especially, I mean, even with the vaginal discharge, which vaginal discharge is healthy, is that it is like a self-cleaning machine or self-cleaning organ. The discharge that is produced, as long as there's no sign of infection, is made to clean out our vagina, which should help keep our pH within normal range. The only time I've really seen it out of normal range, besides just coming off your cycle, is either you just had sex or you have an infection. For the most part, the vagina is within normal pH balance.
Oh, and can I ask a quick question while we're talking about that? And
Mm-hmm.
it's random, but I was reading a Twitter thread where they were arguing about, is BV considered a sexually transmitted disease?
No. I mean, when in the office, we don't consider it a sexually transmitted disease. It's just bacteria. Like, so now there's that's trichomonas, that's a STI. It's not considered the same as trichomonas or gonorrhea or chlamydia, so I would have to say no.
Right. Okay. Thank you.
No problem.
And just kind of going off of that, it's just again out of curiosity, something that's been in my head. So I watch a lot of YouTube, and one thing that I notice is the the influencer girlies who want to go to the gym and stuff like that. They'll go to the gym and they'll work out really hard, and then they'll go eat afterwards, and then they'll go to Target, and then they'll go here and there, and I'm like, you have on those same pants and panties that you just sweated in for an hour. Like, is that acceptable? Like, what is the acceptable range for staying in those sweaty clothes?
I mean,
And can that cause BV?
yes, it can. It's like a breeding ground for bacteria. So yes, it could cause BV because it's bacterial vaginosis. It can cause BV. It can cause a yeast infection. It's just a breeding ground. So I mean, I understand going to the gym, maybe making a quick stop at Target or something, but you really should take a shower or change your underwear. Like freshen up, change your underwear. That's really, yeah. That's part of hygiene. And I mean, things happen. I've even been in the situation where I've gone to the gym and then I finish running my errands and go home. But after a while, it's just like, let me go home and take a shower. So try not to stay in sweaty clothes all day. Yeah. Sweaty clothes, tight underwear, tight jeans, all of that increases the risk for yeast infection and BV.
Thank you.
No
Okay, so
problem.
I'll go back to Tiffany's question now. So her question was, my 15-year-old daughter wants to know why her breast and feet get tender when she's on her cycle.
It's the hormones increase in estrogen. So it is normal. The same way your breasts get tender in early pregnancy. That's a lot of people know they're pregnant because their breasts hurt. It's because of the increase in hormones. So, which we tell a lot of our patients when we're doing the self breast exams, especially the patients who have history of breast cancer in their families, and so they tend to do more self breast exams. If you're ever doing a breast exam and you feel a lump, if it's around your cycle, I wouldn't freak out about it because the change in hormones can cause soreness and different lumps and bumps in our breast. So then I tell them to check again after their cycle is over. But all the hormones cause that. Even some
How
birth
long after
control. If you're on too high of a dose of estrogen in your birth control, some people complain of sore breasts.
how long after their cycle should they wait? Should they wait like a couple of days or all the way up to like a week?
I would say about a week, just to be on the safe side. I don't think it would take a week, but I always tell them wait about a week.
Okay. Those are the questions that we have in the chat for now. So if you want to continue on with the else you had.
Um, okay, let's see. I don't think I talked about periods yet. So, with puberty, girls tend to start their period. normal age to starting their period is around 12. And African American girls, they tend to start a little bit earlier. And also girls that have more weight on them tend to start earlier because we have a lot of estrogen in our fat tissue. So if you're a little bit on the heavier side, you can start your period earlier. And then the period does occur due to the hormone changes in the body. Our ovaries release estrogen and progesterone, and that's what regulates the menstrual cycle. So basically, in our uterus, every month we have a buildup of the lining. And then when our ovaries release the egg, if we are pregnant, then the egg implants. If we are not pregnant, then you'll have your monthly cycle. The monthly cycle normally lasts 28 to 32 days. So day one of the cycle starts the first day you're bleeding, and then every day you count up until your next cycle. And that'll tell you about how long your cycle lasts, the 28 to 32 days. The actual bleeding should be about 5 to 7 days. When a girl first starts their cycle, it does take about 2 to 3 years for it to regulate. We have a lot of teenage patients who come in because they have a lot of cramping. They'll have a lot of pain. Some of them get real nauseous. It's because of, their body is not used to all the hormones yet. So it does take those 2 to 3 years for your body to get used to it. And then unfortunately, some people just have really bad cycles. We also have some patients in their mid-20s who they still just have really bad cycles. For those cases, we can prescribe different medications, one to either help with pain, or some people get on birth control really just to regulate their periods.
So is your cycle supposed to get easier or less painful the older you get?
It should most of the time, yeah.
Okay, didn't know that.
And then around the whole cycle thing, we have PMS, or physical and emotional symptoms that normally occur about a week, so about 7 days before your cycle starts. A lot of that is the acne, the bloating, the sore breasts, which I think somebody asked about, headaches, diarrhea. Some people have constipation, depression. Some people have really bad mood swings right before their cycle starts, irritability. And then in the teenage years, maybe early 20s, some people can have really bad depression and anxiety, and some people even have suicidal ideation during their cycles. So in situations like that, they come in, and if they're having suicidal ideation, of course, we refer them to a therapist. And then those patients we put on birth control just to help regulate. Because if you're in that much pain, or you're that depressed, or you're thinking about harming yourself, then we want to manage your bleeding. Sometimes we'll give you a birth control pill that'll either make your bleeding so light that it's just spotting, which means you won't have all of those extreme mental and emotional symptoms, or we'll do it to where you don't have a period. A lot of moms or older people are concerned when we say that you can go without a period because they feel like you're supposed to bleed every month. So as long as, if you're on hormones like the birth control, and if we're keeping the lining of the uterus thin, then you don't have to bleed. Now, if you're just not bleeding and you're not on anything, then that's where there might be an issue. So estrogen builds up the uterus, and then the progesterone in our body is what makes us bleed. So when we give you the birth control pills, depending on what you're having, that hormone can diminish your bleeding, which will help alleviate a lot of those symptoms. Now, for those who have symptoms that are manageable, we understand that it occurs about 7 days before the cycle. And then once your cycle actually starts, most of those symptoms tend to go away. Now, when the cycle starts, the cramping starts. So it's like you trade one for the other. But the cramping lasts normally the first 2 or 3 days of the cycle for most people. And I always say people who have really bad cramps, or I have a daughter, she'll be 15 soon. And so she has really bad cycles. And I try to remind her. We have an app, so we know when her cycle is going to start. About 2 to 3 days before her cycle starts, I start her on ibuprofen, because that ibuprofen helps with inflammation. And when you're on your cycle, your uterus is inflamed. So the ibuprofen will help control the cramping pain. So you can do ibuprofen during your period, or you can start 2 to 3 days before, and then you can do like a heating pad. Things like that work. If the ibuprofen doesn't work, you would have to go into a gynecologist, and then we could prescribe you either stronger pain medicine, or there's a medication that we could give you that can help lighten your bleeding.
Jackie, for informational purposes, can you just kind of go into, I'm pretty sure I didn't miss this up from listening, just kind of go into a little bit more of an explanation of the period and about the, like what it actually is, like how you said the inflammation of the uterus, all of those details. And I also just want to throw in there that I'm a lucky girly and I don't get menstrual cramps. So sorry for all of you who do.
I was gonna say, don't make anybody else mad on here who gets really bad cramps. My cramps aren't too bad, but my daughters are horrible. So I see both sides. But yeah, so it's a fluctuation of hormones. So day one, we start, you're bleeding. So when you're bleeding, there's a fluctuation of progesterone in your body. The hormones send signals to different parts in your body that then cause the bleeding. So the progesterone, when you're bleeding, progesterone is high in your body. Then everything starts over. You start to get estrogen levels back up. Your uterus has a lining called the endometrium, and each day the endometrium gets thicker and thicker and thicker. When you get to about day 14 or 15, you ovulate. An egg is released. So for those who are older and or trying to get pregnant, they're timing their ovulation. That's normally around days. Some people it's different, but let's say around day 14 to 15, you ovulate. So when you ovulate, you will also notice more discharge. That discharge tends to be clear and sticky. And it's sticky because if for those who are trying to get pregnant, the sperm can stick to it. So that's why it's sticky, to catch the sperm for those who are trying to get pregnant. Or if you're not, then you need to know when you're ovulating and be careful. So yeah, that's in the middle. So you have the estrogen, the buildup, and then the release of the egg. If sperm meets the egg, it'll implant, and the estrogen will stay, your lining will stay thick. If the sperm does not meet the egg, then there's signals sent to your body. Estrogen decreases, progesterone increases, and it tells your body to start bleeding. There are some women who have irregular cycles, and sometimes we have to give them medication to help them bleed. And so basically, we're just giving your body progesterone so that your brain now knows the progesterone is high, and the progesterone will help you bleed. I hope that explains a little bit.
Yes, that was very helpful.
Okay, let's see. Okay, I don't know if we have any males on here, but I know somebody did have a son. So like I said, most of my education is in women's health, but there is the male reproductive organs. So for the women, we have a whole system. Males have a system too. Like I said, women have the 3 holes, males have the 2. They have their hole in their anus and the penis. They have for their reproductive organs, they have their testes, which produce sperm, the scrotum, which contains the testes, of course, and then we have the prostate glands, which this is speaking way into the future, but males have to make sure they get their prostate gland checked. I think they start doing that around their 50s. And then we have the seminal vesicles, which are glands that help produce fluid. to help the sperm move along. And then, of course, we have the penis, which is where the urine and the semen pass through. So as far as teenage boys are concerned, body odor is a big topic. Good hygiene is necessary to help keep that under wraps. So like I said, body odor is normal in both females and males. We have sweat glands even as children, but they tend to get enhanced and during puberty. So the sweat, then during puberty, our sweat mixes with different chemicals that produce that really strong odor. So tips to help decrease the odor would be, of course, to shower and bathe every day, which sounds simple. A lot of teenagers don't. So we actually have to remind them. And then when they shower, to use mild soaps. A lot of people like, using the scented stuff, but if you're dealing with a lot of BO or body odor, we say use mild soap and warm water. And then when you come out the shower, make sure you dry off completely. I don't know if y'all's kids are like mine, but they'll come out the shower still wet and put their clothes on. You have to make sure you're completely dry. With women, make sure you're dry in all the creases and crevices, and the same thing with the males. They, especially when it comes to cleaning their penis, they have to make sure depending on if you're circumcised or not, but you need to make sure you're fully dry everywhere. Kids tend to take a shower, but then put not so clean clothes back on. So you take a shower daily, you put on clean clothes, you make sure you're completely dry, and then, of course, deodorant. Another big thing that they said that teenagers don't do is wash and dry their feet. So a lot of people will take a shower and don't actually wash their feet. So we want to wash our feet, and we want to actually dry our feet and in between our toes.
I think Facebook has told us that a lot of adults still don't wash their feet.
Yeah.
But I wanted to ask, at what age should kids start using deodorant? I have a 5-year-old and she already stinks.
Yeah. So I actually did a little bit of research on that because I have a 7-year-old, and yeah, when she was 6, I was like, oh, we're starting that already. So yeah, she's 7 and she uses deodorant. I don't know which one she's using right now, but I did do a little bit of research to find, you want to use something safe for kids, not with all of the toxic stuff, which, I mean, I guess we really shouldn't be using it either, but I really didn't want to start her off with anything too strong. But yeah, some people start at 6, some people start at 7. It really depends on the kid, especially if they're really active. I mean, nowadays, the school will send a note home and tell you if your kid is a little, stinky. So, and then there's bullying too. So you don't want your kid going to school and, dealing with bullying. So I started mine on deodorant. I did some research, and she's almost, so I think I started at 7. I don't think I started before 7. Let's see. I think that might be majority of everything I had, unless anybody has questions.
I have a question.
Mm-hmm.
Although we are encouraging our teenagers and young adults to abstain, that's really unlikely these days. So from a medical standpoint, what are some tips or advice we can give to our young girls to keep their vagina healthy when having sex?
Yeah, so like you said, of course we would like abstinence, but to be realistic, the only way to keep your vagina healthy when it comes to sex would, one, be abstinence, but then the next thing would be to make sure you use a condom. Don't believe, a guy when he says I'm clean. I mean, what does clean mean? So a lot of guys and girls can have an STD or STI without even knowing. I actually had a patient a little while ago. I think she just came in for a pap smear, and the pap smear revealed that she had trichomonas, which is a STD. And so I then had to call her and let her know, because we had to treat her, and then we then have to treat the partner. well, the partner has to get treated somewhere else. I had another patient. She came in because she was itching and had like vaginal discomfort. So we did an STD test on her. We actually did a swab and looked under the microscope, and we could see the little cells swimming, and that was trichomonas. She came back, she talked to her partner, and her partner said, well, I don't have it. So basically that whole thing happened. But if she has it, then obviously he has to have it too. But guys lie. So I would stress to young girls to don't believe what they say and always use protection. And to be careful, because condoms are not 100% to keeping you safe from STIs, because unfortunately a lot of young people are involved in oral sex, and you can get STDs from oral sex as well. So it's really just a hard topic. But I mean, if they're going to have sex and they really need to be careful, they need to protect themselves. And I don't know how, even as grown women, if we're having sex, even if it's with our partner or spouse, then there's trust there. I still have patients who I tell them, when you're having sex, even if it's with your husband, make sure he washes first, because the penis has bacteria. Grown men still don't have the best hygiene sometimes, and when they put their penis in you, then you can now end up with bacteria. I have a lot of married women who come in with BV because of that reason. And that's the same thing as peeing after sex. It is recommended. It helps. Our vagina cleans itself. The urine that we pee out, sterilizes things. So peeing after sex, making sure the guy's clean, shower before, things like that.
Is it beneficial for men to pee after sex too?
I mean, I don't think it would help, but the thing, like, so with us, their semen is inside of us, and bacteria. Nothing is really going inside of them.
Gotcha. Thank you.
No problem.
Do we have any more questions from anyone else on the call? Okay, if not, if you have questions that you don't necessarily feel the most comfortable asking on the call, or if someone comes to you and you're like, dang, I should have asked this on that call, you can always, again, email us at info@thetroublemovement.org. Or Jackie, if you want to give an email address, maybe your work email address. Is that possible?
Let me see. Maybe I could put it in the chat. So I don't even really know my work email address, but I can put my personal email address in the chat, and then I'll also put my Instagram name on there, because the one I use the most has a lot of nursing topics, and I answer a lot of nursing questions on there.
Awesome. That'll be amazing. Thank you all so much for joining us tonight. Of course, thank you, Jackie, so much for coming on here and giving us this great information. I think we all took something beneficial from tonight. This will be posted on YouTube, and I'll talk to Miranda about this, but I want to post this to my Facebook just so people can have access to this. Because again, I think this was a lot of good information, and I have a lot of young nieces and nephews who need this information. So I want to post this to my Facebook. So I think it would be, as long as it's okay with Miranda, I think it would be advantageous for everybody to do the same. So yeah.
Well, thanks for having me.
Thanks for coming. I was just going to say, any last words from Jackie?
I'm sorry, what'd you say?
As I was just going to say, any last words from you?
This was great. I enjoyed talking to y'all, answering questions. I hope I was able to give y'all some information that was useful. And then if you have any other questions, I don't mind y'all reaching out. I put my email address and my Instagram handle in the chat. So I tend to answer questions.
Awesome. Thank you so much, Jackie. Miranda, did you have any last words?
I do not. Thank you, Jackie. That was definitely amazing. I'm sending the YouTube link to all of my kids.
Nice.
Yes, they would. This is going to be a required homework assignment.
I agree with that.
This is required. This is mandatory.
Well, thank you.
Yeah. Okay, everybody, have a good night, and we'll be back here tomorrow, Thursday, with Finance and Banking with Melissa Pickens. I think that's going to be a good one. I'm very excited for that one. And then Friday, we'll finish up with like a general overview of Q&A, and that will be the conclusion of Zoom University on Friday. As always, 6:30 p.m. on Zoom, and share the link with others who you think will need this information. So everybody have a good night, and thank you all for being here tonight.